Something else that he may be asking or answering questions about today, digging by our CBC News Parliamentary Bureau, is uncovering new revelations about the Trudeau government's response to Canada's PPE shortage last year. You'll remember that having enough face masks to protect frontline healthcare workers from the virus was a major crisis for the provinces at the start of the pandemic. Well, now documents tabled in the House of Commons show the federal government had a chance to obtain crucially needed N95 masks, but said no. John Paul Tasker brings us that story this morning.
Federal bureaucrats working at the Public Health Agency of Canada rejected an offer to buy up to millions of N95 masks last March, just as the country was shutting down social and economic life with COVID-19 caseloads mounting. Provinces were also scrambling to get masks and other personal protective equipment for frontline workers. Honeywell, a multi-billion-dollar company with a history of supplying respiratory devices, stepped forward with an offer, a stable supply of masks. The company was willing to turn over part of its plant in Tijuana, Mexico to meet Canada's needs. But a political staffer in Public Services and Procurement Minister Anita Anand's office said that Canada was not interested in this deal at the time. In a March 19th email, Senior Policy Advisor Kelly Murdoch said, "Right now, N95 masks are not the top priority." I spoke to an infectious diseases doctor in Toronto, Zane Chagla. He says all healthcare workers at the time knew how limited N95 masks were. He said that everyone knew by mid-March that there was a looming shortage on the horizon. He said doctors and nurses were reusing their masks frequently and also relying on creative cleaning techniques to make them sanitary, even putting them in the microwave.
Yeah, absolutely. It was a priority at that point. There were competing priorities like testing, like, regular masks, all that stuff. But, at the end of the day, the people in the critical care units, the people that needed the N95 masks the most, were probably the highest priority on the list to keep things going and keeping people alive, right? And so, yeah, I agree that should have been a high priority project regardless.
A spokesperson for the Public Health Agency of Canada did not respond to CBC News questions by deadline. While slow to start, N95 masks have since stabilized in terms of the deliveries. In fact, more than 100 million have so far been delivered to Canada. But Dr. Zane Chagla said that doctors and nurses should never have faced such shortages in the early days of this pandemic. John Paul Tasker, CBC News, Ottawa.